I'm less reluctant to operate on someone over 80 than I am under 25, you know? So the focus here is on young, but what defines young? We do know that 25 is kind of the magic number that we all use. And we know that the reasoning center of the brain continues to mature until about the age of 25, that's kind of a magic number. So over 25, I'm more willing to say yes under various circumstances. Under 25, the red lights are going on. I'm going to be very, very cautious under 25. So one question is there anyone that's a 1 or a 2 who's under 25? Because I would automatically put someone young, probably a 3. I start them at 3. Once they hit 25, as they get older, they can change a little bit. But my youngest patients, I really want to work with them. And saying no, a lot of doctors think, well, if I say no, I'm going to lose the patient, I'm going to lose the money, they're going to go somewhere else. I've gotten so many referrals from patients who I said no to, and they said, wow, you treated me so ethically. The guy down the street wanted to do 2,000 grafts. You talked me into waiting for a year. That tells me that you're honest and ethical. So saying no isn't a bad thing in any way. You have to know when to postpone it. And like you said, if you develop a communication, a good rapport with the patient, they're going to understand that. And if they end up going someplace else and getting messed up, that's not something that we have to take responsibility for.
I think we have to communicate the risk to that young patient. In answer to your question, if I saw someone that was 20 or 25-year-old who did not have male pattern baldness, but had a condition, and I'm going to give you an example, had a small scar in their recipient area here, essentially no hair loss, would I consider transplanting that person in that small scar just to hide that little area? I would certainly consider it, but take each case individual. So I'm very reluctant to give a hard and fast no or yes, but anyone under 25, there are red lights going off. And if you think about it, there are clinics whose average age of the transplant patient is under age 30. That's certainly an age where under age 30, men are losing their hair. They're very concerned. I think that we worldwide need to open up the awareness of the real long-term risk. I don't like to use the word dangers because it's not a very good word. The long-term risk associated that, specifically the long-term risk of a poor cosmetic outcome due to the transplant itself. So you get a transplant, you fix the bald area, but later in life, the bald area that was transplanted is the only hair left, or there's no supporting hair around here because the person developed extreme baldness, which really no one could predict. So that means there is an element of risk with most people.